Hello everyone, my name is Safwaan Rana, and in this video, we are going to go over chronic obstructive pulmonary disease, or COPD for short. This slide provides a brief overview of the topics I will cover in order. Without further ado, let's jump right in with a brief introduction. COPD is a chronic progressive disorder that causes substantial difficulty in breathing due to airway obstruction and damage such as swelling and inflammation in the lungs. Importantly, COPD includes both emphysema, the damage that occurs to the walls of the alveoli in the lungs, as well as chronic bronchitis, in which the bronchial tubes are inflamed and produce large amounts of mucus. Focusing on Canada, 2 million Canadians over 35 had COPD in 2013, including 15% of seniors between 65 and 69, and 26% of those 85 and above. Moving on, the most significant risk factor for COPD is tobacco smoke from long-term cigarette use. Other forms of smoked substances such as marijuana and pipe smoke are also risk factors, as is secondhand smoking. Workplace and air pollution exposure to chemical dusts can also increase the risk of COPD, as can asthma and gene mutations. And finally, aging can increase the risk of COPD as lung elasticity and airway clearance does naturally decline with age. The key genetic factor in COPD is alpha-1 antitrypsin deficiency, a mutation that lowers the level of a protective protein, allowing enzymes to damage lung tissue and cause emphysema. Let's now shift our focus to COPD warning signs, which unfortunately don't appear until the lungs have already been significantly damaged. Warning signs typically include shortness of breath, cough that involves sputum or phlegm, wheezing or tightness of the chest, continuous feelings of fatigue, lung infections, unintentional weight loss, and swelling in the ankles and feet. Moving on, COPD diagnosis and assessment is a multi-step process. A physician will take note of the patient's history. Next, a physical exam including listening to the lungs with a stethoscope is performed. A variety of lung function tests, lab tests, and imaging are then conducted as the physician sees fit. Most often, these include spirometry as the primary diagnostic test to determine how much air can move in and out of the lungs overall, as well as within a specific time frame, chest x-rays and CT scans which rule out other lung conditions such as lung cancer, and finally an arterial blood gas analysis to determine how well the lungs are exchanging oxygen and carbon dioxide. This brings us to the intervention and prevention strategies for COPD in older adults. The most critical step in any COPD intervention regimen is smoking cessation. Pharmacological treatments include bronchodilators, which primarily relax the muscles surrounding the airways, while inhaled steroids directly combat airway inflammation. Combined inhalers use either a combination of various bronchodilators or a bronchodilator and steroid combination. Antibiotics may also be used to treat respiratory infections, which exacerbate COPD symptoms. Oxygen supplementation may also be used, and surgery may be performed to remove any damaged sections of the lungs. Importantly, a pharmacological therapy known as azithromycin has been found to be the most effective in those above 65. Pulmonary rehabilitation focusing on COPD education and breathing techniques may be recommended as a non-pharmacological intervention, especially in older adults. Moving on to prevention, one of the most commonly recommended prevention strategies is the use of influenza and pneumococcal vaccines. Of course, abstaining from tobacco use as well as using PPE in toxic environments are also important prevention strategies. And finally, let's recap with a summary of the most important points. COPD is a chronic progressive respiratory disorder that becomes increasingly prevalent with age. Key risk factors include tobacco smoking, environmental and occupational chemical exposure, as well as aging-related lung changes. Warning signs include shortness of breath, sputum coughing, chest tightness, and recurrent respiratory infections. Diagnosis relies primarily on spirometry, as well as patient history, arterial blood gas analysis, CT imaging, and X-rays, while treatment combines bronchodilators, inhaled steroids, oxygen supplementation, and pulmonary rehabilitation. Prevention primarily involves abstaining from smoking, vaccine use to prevent exacerbations, and PPE use in hazardous environments. The following slides contain the references. That is it for this presentation. Thank you so much for listening.